This segment is sponsored by Wrye Plastic Surgeons and Aesthetic Treatment Centers.
Hello and welcome to the Daily Mix. I am your host, Connie Wrye. As we age, we all want to look our very best. How do we do that? What products are right for us? Today we're here at Wrye and I am here with Dr. Wesley Hall. He is a board certified plastic surgeon. He is also the co-founder of Wrye Plastic Surgeons, and we're here today to talk about the difference between surgical and non-surgical facial rejuvenation. Thank you so much for being with us here today, Doctor. I am very excited about this. Let's talk about the differences between surgical and non-surgical facial rejuvenation. What is the big difference?
Well, I mean, obviously, you hear the word surgery and you're thinking, I'm going to have surgery, and that's true. Much of what we think about when we're talking about rejuvenation of the face, trying to make ourselves look younger, we think about like a facelift. And in all honesty, that is really kind of the gold standard of facial rejuvenation when we're talking about doing the most we can. Not everybody wants to have surgery. Not everybody thinks, I want to go to sleep. It sounds scary. There are other ways that we can help as well. One of the things that has achieved just a lot of success within the past, I'm going to say 15, 20 years, have been facial fillers. These, you may remember back in the day, we were talking about injecting collagen to improve people's lines and wrinkles and so on and so forth. Collagen is a wonderful substance, but it's kind of tricky to work with. It doesn't last very long. We have new fillers that actually can do wonderful things, particularly for lines that aren't going to be easy to get to with surgery. For instance, around the lines, what we call the nasolabial fold, some of the lines around the mouth, the lips. We have botulism toxin. I know it sounds scary, but Botox. Botox is a wonderful medication. It's a drug that's been around for many, many years, but we can use it to help wrinkles, particularly around the forehead, even around the eyes. And these things can be done without surgery. You don't need to be asleep. You can come in, you can have them done, and they can have long-lasting effects. When I say long-lasting, we're talking about months and months and months. Maybe not years and years and years, though. There has to be sort of upkeep with that. When we're talking about surgical rejuvenation of the face, most people are thinking about a facelift. And there's no question that when somebody has aging that's going on, sometimes the best thing to do is going to be a surgery to help that. And a facelift is, I know it sounds like a scary operation, but it's actually a pretty easy operation for patients to recover from. It can be done relatively quickly, pretty easily with minimal pain, minimal downtime, and it is still a great thing to do for maximal improvement.
How do you determine for your patients which is best? Is it non-surgical? Is it surgical? Do you have them decide upon that?
Well, it depends on what the patient's goals are. So for instance, when we're dealing with the neck, down here in the neck, there's really not going to be anything that's going to be a substitute for actually having surgery. There's not a laser, there's not a filler, there's not an injection that's going to improve the neck as much as surgery. And that's true in other parts of the face as well. But if we're talking about, say, skin smoothing, people have minor lines, lasering may be something that can be done. It can be done in the surgical setting as well, though, because there's different amounts of pain that go on with these things. But yeah, if we're saying what's best for the patient, well, it's going to depend on the patient, what the patient's goals are. How's the patient's health? What are their ability to have downtime, so on and so forth.
I know that you have brought two incredible products here to Wrye that are really helping with those deep cuts, those facial lines and wrinkles that you were mentioning. Can you talk to us briefly about those new products that you...
Well, the fillers, the soft tissue fillers are things that are used. If somebody has really, really deep lines, that's going to be a surgical treatment.
Well, you can find out more about the varying treatments that are here at Wrye by checking out their website. You can also follow them on social media. Again, thank you so much to Dr. Hall for joining us. Wrye Plastic Surgery right here on the Daily Mix.